Many of my clients have complained of fatigue, low energy, problems with intimacy, weight and sleep problems. And although this seems like a laundry list of problems, in reality, these all can be related to a specific root problem. I wanted to focus specifically on how and why your hormonal status can be responsible for some, if not all, of these symptoms. Also, I wanted to address some questions recently about bioidentical hormones. How can bioidentical hormones play a role in helping you achieve optimal health? And why even consider bioidentical hormones as compared to regular hormonal therapy? Our hormones are produced in the endocrine system. This system is a series of glands secreting chemicals which act as a messenger system. When these chemicals attach to specific receptors in your body, they regulate distant target organs like your thyroid, testes, ovaries, and adrenal glands. As you get older, these hormones deplete from your system, and the organs they affect stop working optimally. This results in what people see and often complain about: decreased muscle mass, low energy, fatigue, problems with intimacy, lack of vitality, and poor recovery from physical activity or injuries. Any conversation focused on achieving optimal health should first focus on the toxins you're exposed to in your everyday environment. These will contribute to not reaching an ideal state. Endocrine disruptors, as the term suggests, are chemicals, electromagnetic forces such as 5G, Wi-Fi, exposures that you have about the house, dirty electricity. Chemicals are like fluorides in your water or in your food, in your toothpaste, and in pesticides and herbicides that you're using about your house. Certain foods like soy are powerful phytoestrogens and definitely have a negative impact on men, and the unopposed estrogenic effect has a significant impact on women, especially in women who have families with proclivities to cancer. Non-organic foods treated with pesticides, herbicides, or contaminated soil, air pollutants, and of course radiation. These environmental factors all play a role in disrupting the normal function of your organs. Testosterone levels drop in men, and yes, estrogen and progesterone drops in women as well, but testosterone also plays an important role in women's health and their sense of well-being. Men begin losing testosterone in their 20s and 30s, and women start to lose their progesterone and estrogens in their 30s and 40s. There is a big difference in how people feel when their hormone levels are deemed to be in the acceptable level as opposed to when they're at their optimal level. A local lab reference or a federal standard does not necessarily reflect the levels of the hormones you should have in order to feel at your best. It's at these optimal levels that people feel revitalized and rejuvenated. On top of the lower standards that have already been set, there seems to be an ever-increasing downtrend in hormone levels in our society. What is important here is that, on average, sex hormones decrease 1 to 2% per year starting at age 30. And people lose 1 to 2% muscle mass per year. And often there is unwanted weight gain at this point. The normal range being established by a statistical means has nothing to do with achieving optimal health or improving your sense of well-being. Menopause and andropause affect your mood. Hormone optimization often stabilizes mood and affect, obviating the need for any discussion for anti-anxiety medications or antidepressants. It's well known that testosterone increases lean body mass and decreases body fat. And this is not just in males, this is in females as well. In men and in women, optimized testosterone levels increase libido, energy, improved body composition, mental clarity, and improves sleep. Even if you're struggling emotionally, if the physical drive is there, hormone optimization often can help in overcoming emotional and mental difficulties. Decreased testosterone leads to weight gain, and replacing it optimally will help lose weight, increase muscle mass, but weight can go up. Overall body composition can be significantly improved with diet and exercise, for which you will have more energy to pursue. Even when there is weight gain with testosterone supplementation, there is usually a significantly improved body composition. Estrogen is the hormone of sensuality and usually starts to decline in women's 40s and continues to decline into menopause. Symptoms for declining levels can cause vaginal dryness, hot flashes, night sweats, and painful sex. Estrogens, however, need to be balanced with progesterone. This helps to prevent uterine wall thickening and uterine shedding, and many women notice a significantly improved sleep pattern. They get decreased anxiety, decreased inflammation. They notice an improvement in their joint movement, and it almost acts like a natural diuretic for those bloated symptoms that some women feel. Overall, this is known as the happy hormone. Unopposed or unbalanced estrogen replacement should be a very rare occurrence. But when it comes to optimization of people's hormone status, it's the results of purpose-driven testing that dictates what should be replaced and how much should be replaced. What does bioidentical hormone mean? Bioidentical hormones, unlike hormones that are usually made by pharmaceutical companies, are usually created from plants and are molecularly altered so that they have significant homology, almost look identical to your own native hormones. When you hear the word synthetic hormones, they're talking about non-bioidentical hormones, or hormones that have been created at the pharmaceutical level, where there tends to be only about a 6 to 9% homology. So when your body sees these hormones, it's treating it as a foreign agent, and likely these are the reasons why such complications have been recorded with pharmaceutical grade hormones. The Women's Initiative studied Prempro and Premarin and saw a greater than expected incidence for cancer, blood clots, strokes, heart attacks, and these are things that have not been seen in studies with bioidentical hormones. The fact that this was seen with pharmaceutical grade hormones makes people hesitant to even consider bioidentical hormones, and rightly so. However, a 10-year study that was performed following 976 women did not seem to show any of the increased incidence that was noted on the pharmaceutical grade medications. Further micro-studies that have been performed since that time also do not show any trend for increased risk for cancer, strokes, heart attacks, or blood clots. Bioidentical hormones come in many forms, but the most popular form being the pellets, which are placed under the skin. These are usually changed every 3 to 4 months, and there is a slow absorption of this bioidentical hormone into people's systems, providing relief of those other symptoms, such as low energy fatigue, problems with sex drive. There are also oral forms, creams, and injections that can be used depending on what people desire. Bioidentical hormones have nothing to do with the FDA. The FDA does not regulate this. In fact, it tends to fall under the auspices of an organization called the Pharmaceutical Compounding Boards, and they're all state-based. Again, they also are not controlled by the FDA. Optimized hormone levels are the key for people to feel as if they're in their prime. It is important to say that the root of all people's symptoms should be sought and investigated prior to making any full commitment to use of hormone therapy. A hormone imbalance can be one, if not one of many reasons people are feeling the symptoms that they describe. That lack of energy and vitality has many etiologies, and as we said before, your hormone levels may only be part of the problem. This is why it's important for people to develop a personalized health plan where the results of purpose-driven testing are being evaluated, and this helps to lens out what the cause of these symptoms are prior to committing to bioidentical hormone therapy. The real goal of WPR Medical is to restore optimal health, reduce medications, and prevent diseases and surgeries. Please join our Facebook, Instagram, Choice Social, and YouTube, and visit our e-store where we have curated a huge list of top-of-the-line supplements. You can also click below to make a free 20-minute appointment for consultation to see if we can work together. We are WPR Medical.